Alzheimer's disease. I would say in my practice, this is one of the worst illnesses that I come across. Maybe not just in my practice, but in medicine. Alzheimer's disease is probably one of the major medical illnesses that we face. It is, as the population is aging, this is becoming more important to find a treatment for this than any other illness. To me, it is the big kahuna. It instills fear in me in this practice. When I start seeing memory decline in my older patients, I am alarmed because everything else we pretty much treat. This one, not so much. And you watch people decline, and I try and work with their family members. It is sad. It is the worst illness that I see. So let's talk about treatment a little bit. Alzheimer's dementia. It's basically you form these plaques in your brain, beta amyloid plaques, and your brain shrinks. And over time, it takes about 20 years, but it eventually kills you. Some people are cared for perfectly, can last much longer. But in general, 20, 25 years, that's how long people last. But it's a miserable 20 years. They decline. They don't decline a little bit at a time. It goes fine, then goes off the rails. Goes fine, off the rails. That's pretty much how it works. The last treatments were in 2004. The drugs we've used, the first one that came out was Agresti, donepezil, which is in a class called acetylcholinesterase inhibitors. What it does is blocks the metabolism of acetylcholine, increasing the availability of acetylcholine at the receptor, and that is the neurotransmitter that's used for thought, memory. So we thought if we'd increase it, we'd improve memory and cognition. Didn't work so well. It didn't work very well at all. As a matter of fact, on a scale of 1 to 100, I'll give it a 5, and 100 being the best. It didn't work well at all. Then, what was the next one? Galantamine. Razodine came out. That worked just as well as donepezil. Agresti. Then a third one came out. What was that one? Rivastigmine, which is Exelon. Nothing really worked that well. A fourth one came out, a new class. It's an N-methyl D-aspartate, another way to affect the brain and help with memory. Memantine, Namenda came out. That worked a little differently. Nothing worked. Since 2004, nothing has worked. Well, this new drug, Aducanumab, which is a monoclonal antibody, is now submitted all their papers to the FDA. And it's possible this drug could be on the market sometime in the first 6 months of next year. This is revolutionary, this drug. It's the first drug in 16 years, and it works in a totally different way. So it's opening up the gates for exploration in a whole new area. The plaques that form is called beta amyloid plaques in the brains of people with Alzheimer's. A normal brain is pretty clear, but this has all these little protein packets of nightmarish plaques that form. And they think that these plaques destroy the brain, but it's not known whether it's a byproduct of destruction or they're actually destroying it. But these will clear these plaques. Now, aducanumab, it sounds like a big word, but umab at the end of any word means monoclonal antibody. What is a monoclonal antibody? By the way, it's an injection, an infusion you give once a month. That's what this new treatment involves because it's too big. It's a gigantic molecule. It has to be infused into your veins. What a monoclonal antibody is, and the microbiologists will scream at me and say, that's a ridiculous explanation, but I'm going to give you the Reader's Digest version of what a monoclonal antibody is. They take an antigen, which is a protein, that affects the immune system in a mouse. And the mouse mounts an immune response. And those cells, polyclonal B cells that mount that response, are then harvested from the mouse. You kill the mouse, You take its spleen, you flush the cells out, which produce this antibody to this antigen that you gave the mouse. Then you take these cells and you take a myeloma cell, a cell from someone's bone marrow, from a human, and you alter that cell and turn it into basically a cancerous cell so it keeps on dividing and does what you want and doesn't specialize. And then you create a hybrid cell by taking that mouse cell and this mutated human cancerous myeloma cell and form a hybrid cell. And that hybrid cell produces a antibody or a protein, and you grow it in a culture medium, and then you harvest that, and then you infuse that into a human. Woo! That is what a monoclonal antibody is, and it's much more complicated than that. And please forgive me that I oversimplified it, but listen, I got to keep these videos around 5 to 10 minutes. So this is a major breakthrough. It's a company out of Japan, Biogen, which is coming up with this new drug, Aducanumab, which should be out next year. This looks hopeful, very hopeful. More hopeful than I've been in 16 years. I thought Namenda was the last one to come out 16 years ago, and I thought, okay, this will work. This is at least hope that something will work. And this looks very promising because this will lead the way for new drugs. And I have my prayers go out to family members who have a family member they're caring for with Alzheimer's and the individuals themselves. If this is a blessing, I don't know. This is my most feared illness. But when you're going through Alzheimer's, you do not realize you have declining mental faculties. You don't think anything's wrong. It's very difficult on the families. I spend a whole chapter in my book, Tales from the Couch, shameless plug, on Amazon.com, talking about the effects of Alzheimer's disease and caring for the Alzheimer's patient on the families. It's heartbreaking. My heart goes out to these people. It's just absolutely heartbreaking. I should do a video on the stories that I've heard. Getting up in the middle of the night, these people with Alzheimer's are peeing in the garage. They're walking around the house in the middle of the night thinking it's daytime, and they're getting up, eating dinner in the middle of the night because they forgot they had dinner. They forget time. They eat the same things over and over again because they don't realize they ate. One person kept feeding the dog over and over again. The dog got obese. He kept forgetting he fed the dog. This individual would get lost when he went to get the mail. He didn't know his way back. It gets pretty bad. One of the hallmark things that these Alzheimer patients, when they first come to the office, the checkbook, boom, lose the checkbook, or when something unusual happens in the car, an accident, or they get lost, forget it. If it's any new place to go to or anything unusual happens, a detour, they're gone. They cannot respond. It is a horrible illness. And they get very angry and frustrated because they don't realize that they're saying the same thing over and over, and they get frustrated with the people around them, keep saying, and the loved ones say, you just said that. You just ate dinner. What are you talking about? You can't wear that. You cannot wear a bathing suit to go have dinner. And they start getting really bizarre, inappropriate behaviors. So anyway, I'll get into that later. I'm about to do one on college. Thanks, Dr. Mark Agresti. I'd appreciate the subscribing, comments. And if anyone has any ideas, write in the comments for a new video. See you later. Bye.